Good morning, everyone. This is just a case to just for public awareness. So, so I have no conflict of interest and no financial interest. So it is a rare but serious ophthalmologic and psychiatric emergency that usually occur in patients with severe schizophrenia and is life-threatening. The management usually is multidisciplinary, using ophthalmologists, psychiatrists, and neurologists in order to detect any associative lesion. Although it's rare, this phenomenon is still important to be recognized because of its visual and vital prognosis. So our case, what we have dealing with recently in the casualty, one 26-year-old male came to casualty with accompany his father and friend with self-mutilated or enucleated his right eyeball completely. The eyeball was put in the plastic container with request to put it back, and he was suffering for multiple episodes of auditory and visual hallucination and was taken to local quack and tantric for the treatment family. But because of this command hallucination and visual things, see, he got irritated and finally enucleated his eye. Now, when do ocular examination, obviously there is some excoriation, swollen and excoriation of the skin tag, and eyelash is matted, but cornea, the eyeball, the whole eyeball is nucleated, and conjunctiva there is tear. Left eye is very fine, and with visual acuity 6 by 6. So in fundoscopy, all this is the enucleated, and other eye is fine. So what treatment we have done? We have done the mild excoriation thing, and some laceration is there. So we have done lead suturing of the both eyes with removal of the remaining irregular tissue and skin tag. Dressing was done. Patient was started with injectable of course antibiotic and referred to the psychiatrics department for further evaluation. We have done only NCCT of the brain to rule orbit to rule out an external injury and the presence of any foreign body. And after 2 to 3 days, patient was again operated in minor OT where the stitches of underlying conjunctiva tissue and trimming of the dead cell and finally conformer and placed in the shape and contour of the right eye. So this is the final picture of the patients after putting the prosthesis. The psychiatric consultation, he was diagnosed a case of paranoid schizophrenia. He was on tab respiration, trihexapyridine, clonazepam is being followed till death in the psychiatric department. In month later, the injury was healed and excellent tissue recovery, and prosthesis was then finally implanted in the right eye. This is the prosthetic eye. So as we discuss ADPism, as we all know the things what ADPism happened, what is the history behind it. So most of the ADPism cases in the literature and association with psychosis, bipolar disorder, OCD, a schizoaffective disorder, and substance abuse. In our case, we find this hallucination thing and paranoid schizophrenia, grandiose, what we has getting commanding hallucination and do these things. In Indian literature, only 5 cases could be found, among which 2 cases had an association with schizophrenia, one with acute transient psychotic disorder and with depression, and one with bipolar with erotomanic delusion. This case, one bipolar and erotomanic delusion, is found recently in and this study is published in this case is published in IGO case report in AIMS, conducted in AIMS now 2024 only in August. And cases associated with bipolar and schizophrenia involved made patient experience religious or command hallucination, what put them back, commanding to remove his eye. This biochemical theory proposed self-enucleation could be associated with dysfunction of serotonergic and dopaminergic and opioid system. Mostly there is serotonergic high upper activity, and there is dopaminergic negative feedback is there. So there will be this thing is happening. So neurological evaluation should be done to rule out complication like intracranial hemorrhage, chiasmal injury, infections. Along with schizophrenic patient, they have done so many things. So you have to rule out all the neurological evaluation along with NCCT brain, and if required, there is MRI also. More research is required to understand the prevalence, underlying etiology, motivation, and its social impact. So to conclude, this case highlights the need for early identification, structured assessment, multidisciplinary approach to treatment and rehabilitation. Rural people should be made aware of ill practice and this tantric things, and to preventing the far out place by local quacks, and myths and facts about eye transplantation and corneal transplantation should be addressed. So these are my references. Thank you.
Very unusual
Yes,
presentation,
sir.
guys. And don't mind my ignorance. I just wanted to know the meaning of ODIPISM. Like even Dr. Ravi was saying, like, this is the term we, as ophthalmologists, we are listening for the first
Sir,
time.
EDPism,
What
that
does it
is
signify?
actually there is a history behind this. One this thing is the one king is there when the son.
हाँ
हाँ हाँ
हाँ
वो उसका हाँ जेसिका उसका वाइफ के नाम थे, उनका बेटा था वो इडिपस था, जो
अच्छा
उसका लव रिलेशनशिप उसका मदर के साथ आ गया था। तो व्हेन ही फाउंड आउट टू रिग्रेट हिज सिंस ही फोल्ड मतलब ब्लाइंड फोल्ड हिज आई and
ओके
again his mother committed suicide. So
ओके
this is the Oedipus, and we found in our MBBS days we read this Oedipus Electra complex. This thing in 2 to 3 years, if the things is fixed and there is love affair, her son to his mother and father to his daughter, and if this stage is not going beyond, and there's some trauma, some depression, psychological thing is happening, the stage is static is there.
ओके
So this thing happened to Oedipus, who has done this sin to his mother. Then he not remove his eye actually, but he has blindfold his eye. So after that, this thing,
yeah
Oedipism complex is there,
good very
and
interesting to
yeah,
know
this is the self mutilation cases.
yeah
Is it possible to remove own eyes?
Yeah, every
how he
in
must
a,
have
in a
enucleated
recently
Murray.
Recently, AIMS people have done these cases. Actually, I have go through the article, this IGO case report in 2025 August only. They have found this in psychiatry department has published this article along with RP Institute. They have come across this case, and this case was a case of substance. And this patient has erotomania with some actress, and he can't see that actress with anyone else, anyone movies, and he found that he has constant thought that this actress with in being harmed by any other one, and I can't protect her. Yeah, so he self-mutilated his eye. This is a
The reason
erotomania
of
case.
self-muting is
So,
something. The
Yeah.
process of self-mutation is
It's
yes
a
not
finger
that
rules also.
with finger it's not possible to cut optic nerve.
No, no, this case is not with fingers, but I found that
Even
article
with
with.
blade, I don't think what kind of is accessible with
And these
blade.
people not full.
And थोड़ा सा भी करने
Don't
के बाद
yeah,
इतना
they don't
दर्द
feel
होगा.
pain. Don't feel pain. Any suturing also, we don't put any
Fully
local
motivated
anesthesia.
and
Yeah.
even in
we
severe of traumas, patients do not have any pain.
yeah
in whole cases we have
I
don't
don't know
put
which
any
kind of
anesthesia.
chemical khichdi is there that
Yeah. Yes, sir.